Carolyn Fernandes. I'm one of the faculty here at the University of Pittsburgh Medical Center, and I'm the director of the travel clinic at the Center for Care of Infectious Diseases. And I'm here to tell you a little bit about the travel clinic. So, international travel has been consistently increasing over the past so many years. And the World Tourism Organization actually forecasts that by the year 2030, we're going to see a 3.3% annual growth. And they predict as many as 1.8 billion travelers will go to foreign countries. And so travel to emerging and developing countries will certainly increase from the levels it's at today. And what does that mean for the traveler, right? So it's going to expose the traveler to maybe unfamiliar environments and potentially new risk factors that may have health risks. And if you look at why people are traveling, it's for the things you would expect. So 55% is for leisure or vacation travel, with business travel accounting for 11%. And then about 1/3 are going to visit family and relatives or friends, as well as maybe religious and other purposes. And the dominant mode of travel for people arriving to new countries is using the airplane. So the travel clinic actually has a role in two settings. One is for pre-travel consultation to kind of prepare travelers, for anything that may arise during travel, but then also for the post-travel visit in case you actually do develop an infection, to make a diagnosis and treat that. And who does a pre-travel visit? So typically it's done by a travel medicine specialist that has specialty training and often certification. There are several different organizations in the US and the world over that provide this. It may be a physician or a nurse practitioner or even a physician assistant providing this care. And the main objective of the visit is to do three things. One is to assess the individual risk based on that person's health conditions. Two is to discuss, specific destination-related health risks. And then the third thing would be to provide then counseling on how to mitigate risk. And this may include using immunization, certain medications, as well as other, common sense measures. So who needs a pre-travel consultation? Pretty much everyone, but especially, if you are a traveler that has a complicated health history, such as you're immunosuppressed or you've received an organ transplant, even existing health conditions, such as people with diabetes or hypertension or heart disease, could benefit from some advice. If you're elderly, if you're pregnant or breastfeeding when you're going to be traveling, and then if you're doing certain special things, such as you're going to high altitudes, or maybe you're going to provide, humanitarian aid assistance or work in refugee camps. And then certainly for people that have complicated itineraries, going to multiple different countries, there would be benefit to seeking consultation. And what do we do when we see somebody for a pre-travel visit? So there's two major components of this. There's really no physical exam. It's mainly obtaining an accurate history and then providing counseling. And so in the history part, one is to do the traveler specific history, looking at, what past medical conditions you might have, what medications you're taking, allergies, but then also if you've received prior routine and travel vaccines, because that would impact how we advise you. If you've had illnesses with prior travel, and then what your experience may have been if you had to take, say, malaria medications before. But then the other big part of this is details about your trip. So what countries you're going to and what's the order of travel, because that's important. Are you going to be in an urban or rural setting? Certainly the reason for traveling, if it's pleasure or business or missionary work. A key component that we like to know is when you're going to depart and how long you're going to be away for. And then certainly personal travel styles. Are you going by yourself, backpacking and trekking, or are you going as part of an established group? And what the personal traveler risk tolerance is, because that again impacts what sort of advice we give you. And then any specific activities that you intend to do when you're away, whether it's diving or climbing to high altitudes, participating in extreme sports, going on a cruise ship, etc. And then the counseling part, right? So that's certain advice that we give people, as well as specific health recommendations. And this would be talking about things like insect and mosquito bite prevention measures, how to consume food and water safely, including road safety. So the number one cause of actually death in travelers is related to motor vehicle accidents and road accidents. We talk about having a checklist for over-the-counter medications and things that you routinely take that you want to carry with you. And then also talking about the role of travel medicine insurance with evacuation coverage. And here, most of this good communication is the key with your provider. For specific advice that we give you, it includes two big things. So immunizations, right, to make sure that if we have a vaccine preventable illness, that we can certainly try to protect the traveler. For routine things like tetanus, influenza, the measles, mumps, and rubella shot, to specific travel vaccines, which might be hepatitis A or typhoid, Japanese encephalitis, and yellow fever. Malaria chemoprophylaxis is essential because that can prevent you from getting malaria when you come back from your exotic safari vacation. Talking about ways to prevent and manage travelers' diarrhea as well as altitude illness. And then in the times of our COVID-19 pandemic, right, talking about maybe country-specific restrictions, the need for testing before travel. And again, immunization, getting the COVID-19 vaccine is one of the big ways to reduce your risk of getting sick when you travel. There is a caveat though. So pretty much most insurances will not provide coverage for a pre-travel visit. So it's an out-of-pocket fee. And also certain immunizations as well as medications may not be covered, such as malaria medication. However, the way that I like to tell travelers to think about this is you're going to pay a lot for your trip and to maybe sightsee if this is pleasure. And you want to consider the pre-travel visit as part of that cost so that in general you have a safer trip and do not have to worry about illness either while you're away or when you come back. Certainly post-travel visits are covered by insurance to diagnose and treat infection. And so at the end of this all, the only thing left to do then is to travel. All right, thanks so much for listening.